Hi, my name is Lydia Clement from Tennessee Wesleyan University. I'm an occupational therapy student, and I'm here to talk with you today about telehealth and occupational therapy. The objectives of my talk today are creating your own definition of a telehealth, being able to answer how is telehealth used in OT practice, what are the benefits of telehealth and OT, what populations can benefit from OT and telehealth, what are some barriers and limitations to telehealth delivery, and being able to transfer this knowledge. So I want you to take a moment and think about what the term telehealth means. You can break it down into the term tele and health. So tele means at a distance. So this is providing healthcare services at a distance. This can be synchronous, so live service delivery. So that could be through a phone call or through a video chat. And then there's also asynchronous, which is recording, like how I am right now, recording a message, sending that to a client, and then benefiting from that recording.
Telehealth appointments allow for a flexible location for the provider and the patient. Commonly, patients receive a telehealth appointment with their doctor using video chat technology, similar to Skype, but with a sophisticated, high-security network and specialized devices that allow the doctor to assess them even though they are not in the same room. There are several benefits to telehealth. The burden of travel may be reduced, you may be able to see your doctor sooner than normal, and you may have access to a larger variety of specialists that might not always be available in your hometown. Every moment counts when you or your loved one is in the midst of a medical emergency. Telehealth technologies allow for just the right specialist to assist the emergency care team wherever you are. When you need to be seen right away for an issue like a cough or cold, telehealth urgent care appointments can provide you with exactly what you need. The provider can assess your symptoms, give recommendations, and write prescriptions, all while you are comfortable in your own home. For those patients with chronic diseases like MS or epilepsy, many routine appointments are required to check in about medications and have routine scans. Telehealth appointments can ease the burden of travel and provide greater access to your providers. Telehealth brings healthcare to wherever you are. It's the first step of many to give our patients exactly what they need, when they need it, and in the most comfortable way possible.
So these words are all very similar to telehealth, and it's just different services and what they term their service from a distance. So that's telemedicine, e-health, telerehabilitation, telecare. But AOTAs has endorsed the term telehealth, and in their definition, they include health and wellness applications into our definition. So not just illnesses or sickness, providing care to those, but it's also providing care to prevention of illness and just promoting that health and wellness. So the benefits of telehealth and OT services. Take a moment and just think about some of the benefits that telehealth can have in OT. For me, personally, I am from a small rural town in Georgia, and I think that telehealth would be so beneficial for serving my community. It is underserved, and it doesn't have all of the health care that individuals deserve. And so I think telehealth would be a really great resource for individuals to have to get the care that they need. So some of the benefits that were found are it improves access to rehabilitation services and specialists. It prevents unnecessary delays in receiving care. Weather events and other disasters can affect travel, so telehealth can subside those. Similar to the pandemic that's going on right now, telehealth is a great resource for this disaster. It can help facilitate coordinated care and interprofessional collaboration, and it can also provide access to services for individuals in remote or underserved areas, like I said before. So what are some populations that can benefit from OT and telehealth? They're all listed right here. So children and youth, productive aging, mental health, rehab and disability, and then work in industry. So we're going to go into each of those and just see how OT can really work through telehealth in these populations. So with children and youth, two big services that we can provide are early intervention and school-based. So with early intervention, this was mandated through Part C of the IDEA, and it provides services for children that have developmental delays. And so OTs can really work with these children to promote skill acquisition, improve quality of life for children with disabilities or developmental delays. And we can work on meeting those developmental milestones. And early intervention children are already in such a vulnerable state. So home health care or telehealth is such a good resource for these children since they're already in such a vulnerable state, and just keeping them where they're comfortable and where they can learn. And then school-based services, we can provide services through for underserved communities as well that don't have built up special ed programs, and there's special needs children that need OT services. So telehealth can be served in that way, but then also OTs can collaborate with other interprofessional teams to create programs and to work together to help the schools. And so they can create wellness programs, and it has been seen that OTs work really well with creating programs for obesity, prevention of obesity in the population, and prevention of violence. And that's huge with mental health as well. So I think that we have a lot of good that we can provide through school-based services as well. So with productive aging, our main goal is to limit healthcare costs and hospitalizations through promoting health and wellness and prevention of disorders. So OTs work to monitor occupational performance. They teach self-management skills. We can recommend home modifications, and then we can also provide occupational therapy services and occupational interventions that can promote occupational performance and improvement of occupational performance. And then we also work and promote health and wellness and prevention of in the self-management of chronic diseases and obesity. So when we're managing these chronic diseases and obesity, it's preventing further illnesses in the future and further hospitalizations in the future. So with mental health, our main goal is to just promote meaningful occupations again. We want to promote participation in the daily activities that give individuals purpose. So a large part of OT's role in this population is assessing function and then also encouraging psychological and social function in the home, in the workplace, and in the community to just promote a whole well-being. Rehabilitation, disability, and participation. So OTs work with individuals on their stroke rehabilitation. They're in a vulnerable state, and they've already gone through the rehabilitation in the hospital and maybe in the skilled nursing facility, and it's time for them to return home, but they still need that support. So OTs can work through telehealth to continue that rehabilitation process. We can work for promoting hand function in Parkinson's disease and other neurological disorders. We can provide ADL assessments and see this function and see how they're functioning, and then we can provide durable medical equipment assessments and recommendations based on that, or assistive technology assessments and recommendations based on that. We also work with community reintegration, whether that's with stroke or any other recovering population. And then we can also assess fall risk. And if an individual is a high fall risk, we can refer them out to go seek more care somewhere else. Last but not least, we also work with work in industry. So this is an up and coming thing with telehealth because it's hard for people to get time off to go get services. So working with work in industry through telehealth is providing them the care that they need. So with this population, we do remote assessments. We can analyze workspaces. We can educate and train workers on better body mechanics or other things that the company wants us to promote. And then we can also make recommendations for modifications. And so this is with tools, workstations, or environments just to prevent further injury or prevent injury as a whole. So here are some evaluative measures that have been proven to show progress in telehealth and OT services. The Montreal Cognitive Assessment, the Mini Mental State Exam, the Functional Reach Test, the Clement Evaluation of Living Skills, the Canadian Occupational Performance Measure, the Timed Up and Go Test, the Functional Independence Measure, and the Ergonomic Assessment Tools for Arthritis. So with reimbursement, insurance is such a big thing in the health field. So right now, telehealth is only covered by private insurance in 22 states. We are also reimbursed through contractual and private pay because OT services are not yet telehealth providers under Medicare. And then Medicare reimbursement varies by state. And right now, only Kentucky and New Mexico are. With limitations and barriers, some limitations are OT practitioner licensure portability. So this is if we are licensed in one state, we cannot provide telehealth services in another state because of legal issues across states. Telehealth regulations can vary. HIPAA, so patient confidentiality is a really big issue with providing services from a distance. So making sure you're on a secure network and all patients' information is confidential. The insurance issues that we just discussed, and then providing interventions from afar. We need to make sure that we're safe in that. And as clinicians, we need to make clinical judgment on what we can provide interventions for and what needs to be hands-on. And then some barriers are socioeconomic status, Wi-Fi access, and cultural issues. So this can all hinder our clients from being able to participate in telehealth services. So with occupational therapy, advocacy is such a large part of our scope of practice, and we need to always be advocating for our clients and for ourselves in our profession. So with this age of new telehealth delivery model, we need to advocate for the benefits of our OT services, and we need to revise the CMS language of right now we're called suppliers, while other healthcare professionals are called providers, and they can provide telehealth services. So we need to revise this language so that we can provide telehealth services to our clients. So in this COVID-19 time, telehealth is really growing, and some insurance companies are slowly allowing telehealth reimbursement during the pandemic. And while they're available during the pandemic, we aren't sure what will happen after the pandemic. So we need to continue advocating for the use of telehealth services during this time, but also after. So, a lot of those barriers we can overcome through increased awareness, education, and advocacy for telehealth as a valid service delivery model within our profession. We need to develop professional standards and guidelines. We need model regulatory language to help with documentation and reimbursement in this area. The inclusion of telehealth and accreditation standards, textbooks, and educational curriculum, continuing education opportunities for experienced practitioners so that they feel confident in their service delivery through telehealth and providing interventions through this manner. And then education and resources for stakeholders. We need to be comfortable with talking to our legislators, with reimbursement entities, with practitioners, and with our consumers of the benefits of telehealth and how these can benefit our clients. And I think Tennessee Wesleyan has done a great job at including in our curriculum telehealth in our standards, our textbooks, and our education, and our professors urging us to educate and send resources to our legislators. So now during this, I just want to urge you to transfer this knowledge to the next person you see. I want you to teach them one thing that you learned from this session. And I also want you to think, as a future OT practitioner, how can we continue the research of telehealth? How can we continue to provide knowledge of how this is progressing our clients? How can we continue to progress this field? And now I'm going to be showing you a telehealth session with the work in industry. Disclaimer, I am an occupational therapy student with Tennessee Wesleyan. I am completing a telehealth session as a part of a learning project for 612 Scholarship of Learning and Teaching. I am not a licensed or registered healthcare professional. The client today is aware of these conditions and has consented to being filmed for this project. Hi, Mr. Henry. How are you today?
Good, how are you?
I'm Lydia Clement. I am an occupational therapy student from Tennessee Wesleyan. I just wanted to make sure that it's okay to film this again. Are you okay with that? All right, perfect. Thank you so much for being a part of my learning project. It means a lot. So how are you feeling with your previous wrist fracture and shoulder dislocation?
It's still giving me some issues, but working through it.
Good, I'm so glad. So I know that it's a busy time for you right now, and last week we had to email back and forth, but I'm glad that we got to set up this telehealth for today and chat with each other. So last week we were able to talk about working on your workstation and cleaning up to prevent falls. How did that go?
It went well. Haven't really fallen again, and it's really helped keep things organized and prevent the chance of it happening. So.
Great. So you're feeling more confident with walking around and not falling?
Yeah.
Great.
Sure.
So I also introduced some body mechanics, some principles of body mechanics last week. How do you feel about those? Do you remember any of them?
I remember something about lifting with the knees.
Okay, yeah, that's a good one. There's a couple more, so we can go over those again today and hopefully apply them back to your work. So 3 things we're going to talk about are posture, standing, and lifting. So with posture, that means holding your shoulders back, keeping your head up, a neutral spine, and then with standing, it's having your feet shoulder width apart to be more stable to prevent falling. And then lifting, you're bending from your hips and your knees, like you said. When you're holding heavy objects, you're holding them close into your body. You're setting your muscles before you're lifting to add force and add power to lifting heavy objects. You're going to exhale during exertion, and then you're also going to avoid twisting. So I was so glad to see you take some pictures last time so I could see your body mechanics, and we could make some adjustments with that. So thank you so much for doing that. So do you have any questions about those principles of body mechanics?
Yeah, what does a neutral back mean?
Yes, that's a good question. So whenever you're standing, there's a little curve in the bottom of your spine that is supposed to be there. So the curve will keep your hips aligned. So that's what a neutral spine is. It just keeps it all together.
All right.
Anything else?
Should I carry or roll tires?
Well, that's up to you. If rolling is easier, that could take some pressure off your back. But if you do want to carry them, just make sure you're holding them close into your body so that you're not displacing your center of gravity or center of mass, so that you're not more likely to fall. So just make sure that you still are doing the proper body mechanics when you're carrying a tire, if you prefer to carry a tire. But rolling should be fine too, so it's whatever you prefer.
And also, what does setting your muscles mean?
Oh, yes. Okay, so thank you for asking these. So this means contracting your muscles. So whenever you're setting them, you are contracting them so that there's force there to lift the objects that you want. So that means like your core or your legs. Yeah. Anything else?
I think that's all I had.
All right. So this week, today we are I want to learn about the tools that you use and if you're having any problem. So do you have any examples of tools that you're using on a daily basis?
I've got some right here. All right. So this would be an impact.
Okay. How do you use that?
Typically, you'll use this to take off lug nuts of wheels and tires. So
Okay.
put it onto the nut, and then it
Cool.
twists. So
That looks pretty heavy. Is it putting any strain on your wrist?
it is actually.
Okay. So whenever you're recovering from a wrist fracture, you need to make sure that you're not putting any added strain on it so that it can recover fully. So my recommendations would probably be to hold it with both hands. So bilaterally using it to hold the impact so that you can use it in a way that's not putting as much strain on your shoulders or on your wrist.
All
Do you
right.
think that would work?
It should, yes.
Cool. So another thing that I could recommend, if that just isn't working for you, is maybe a wrist strap to make sure that there's the proper alignment in your wrist so that it's recovering, and making sure that the position isn't compensating for any lost movement or any abnormal movement that could happen. And I can email some ways to wrap your wrist if you're okay with that. Cool. So another place we can apply this is just in daily living. Carrying heavy objects can be really straining on our joints in the shoulder or on the wrist. So whenever you're holding really heavy, like a milk jug or a pitcher of water or tea, it could be good to carry it with two hands until you can place it down, just to not strain your wrist anymore. Does that sound like a good?
Yeah.
Cool. So are there any other tools that you can teach me about?
I have a jack as well, which is typically used to lift the vehicle. You'll slide it under, then you pump to raise the vehicle off the ground if you need to take tires, wheels,
Cool.
etc. off.
How is that affecting you?
When I lift, it kind of hurts my shoulder. Seems to put a lot of strain on it.
Yeah. So with your shoulder dislocation, were you in a sling?
Yes.
Okay. So you were in a sling for about a month or 2 months? Do you remember?
About 2 months.
Okay. Yeah, so being in a sling for that long, it can really affect your range of motion. And so doing those small movements over and over can be really, it can really take it out of you, honestly. I mean, your joint hasn't done that motion in so long. So I would recommend maybe strengthening that back up by doing full range of motion. So bringing it all the way up and down instead of the short motions that you showed, so that you're not getting fatigued as fast, and so that you are able to strengthen up that joint. Because yeah, slings can be really debilitating in a way of not getting that full range of motion for so long.
Yes.
And then also when you're using the jack, just be aware of your body mechanics, with standing, with your stability, with your posture, keeping the shoulders back, your head up, not slouching over. And yeah, with the jack, that could also play into another aspect of your work of cleaning cars or cleaning anything, or even at your household cleaning. Getting that full range of motion instead of doing the smaller ones and fatiguing your shoulders so quickly. So do you have any other questions about what we've talked about today?
I don't think so.
Okay. So I think next week, if you have any other tools that are hurting your wrist or your shoulder, I'd like to talk about those again, and I'd like to get a follow-up of how these recommendations have been, if that's all right with you. All right. So I will see you next week at the same time, same place. Is that all right? And then just email or call if you have any questions, and I will email that wrapping technique for your wrist. All right. Thank you so much.
Thanks for all your help.
So in conclusion, today I hope you were able to come up with your own definition of telehealth that you can be able to tell to someone else so that they can better understand what telehealth is. I hope you can answer the questions, how telehealth is used in occupational therapy practice, what the benefits are for telehealth and how they can benefit clients and practitioners, what populations benefit from occupational therapy through telehealth delivery, and then what a couple barriers and limitations are for telehealth, and how we can overcome those barriers. And then I also hope that you're able to transfer this knowledge, that you can explain this topic to someone and what the benefits of telehealth are, and that you can think about how, as future OT practitioners, how we can further this field through research. So I hope that you get to think about all of these things today. And if you have any if you have any questions or concerns, feel free to email me at lmclement2019 at tnwesleyan.edu. And also I have a quick survey, so feel free to email me and I will send you that link. It's just a survey of how this talk went today, what you learned, and any ways that I can better my presentation. So please email me, and thank you so much for listening.